Learning outcomes. After studying this module, you will be able to know about the various legal provisions related to drug usage, the statutory regulations for the prevention of drug abuse, and a brief overview of the NDPS Act 1985. Now, let us start with the introduction. Drug in the comprehensive sense is any chemical object or mixture of objects other than those required for the maintenance of normal health, the administration of which changes the biological function and bodily structure. However, the second level of explanation could then specify the users to which these objects are put, that is the drugs used for the treatment or mitigation of disease known as medications or the therapeutic agents. Thirdly, one may discriminate the chemical entities based on bodily system or function on which they apply their most noticeable or obvious effects like the diuretics, CNS stimulants, etc. The leading concern is about the possible adverse effects on health or social function. Abuse and misuse are unsatisfactory conceptions because these terms consist of valued judgments which are impossible to define in such a way that they are applicable for different drugs in different situations. Drug abuse has been well defined as the persistent or the sporadic disproportionate drug use inconsistent with or disparate to conventional medical practice. Further endeavors to achieve a comprehensive definition of abuse have been considered contingent to the medical need, individual and social harm, and the degree of tolerance by the community. Drug abuse refers to the use customarily by self-administration of any drug in a method that deviates from the ratified medical or social pattern within a given culture. In some culture, some drug substances are not considered against the society and so may not be against the legal system of the country. Use of medically prescribed drugs, for example barbiturates to induce sleep, is permissible, but if it is used to induce euphoria, it is called as drug abuse. In another illustration, opiates can be taken when recommended medically for the relief of pain, but not merely for its euphoric effect. When people continue to take these drugs in the absence of disease, intensity of dependence varies from mild desire to the compulsion to use the drug is called as drug abuse. Now starting with the Narcotic Drugs and Psychotropic Substances Act of 1985. The Narcotic Drugs and Psychotropic Substances Act, that is the NDPS Act, was enacted in India and subsequently amended in year 1988 to implement the provisions of the Convention on Psychotropic Substances in the year 1971 and the Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances 1988, both held in Vienna. This act renders obsolete three previous acts, which are the Opium Act of 1857, the Opium Act of 1878 and the Dangerous Drugs Act of 1930. The term narcotic in the legal sense is quite different from that is used in the medical perspective, which signifies a sleep-inducing agent. Legally, a narcotic drug could be an opiate, that is a true narcotic, cannabis, a non-narcotic, or cocaine, the very antithesis of a narcotic since it is a stimulant. The term psychotropic substance is with reference to mind-altering drugs such as LSD, phencyclidine, amphetamines, barbiturates, methaqualone, benzodiazepines, mescaline, psilocybin, and the designer drugs such as MDMA, DMT, etc. The NDPS Act imposes comprehensive prohibition on the cultivation of coca, poppy, and the cannabis plants and the manufacture, sale, purchase, use or transport of any narcotic drug or psychotropic substance except for medical or scientific purposes. The minimum punishment for any offence committed under this Act is 10 years of rigorous imprisonment and a fine of rupees 1 lakh, while the maximum punishment is 20 years rigorous imprisonment and a fine of rupees 2 lakhs. There is also abundant scope under the NDPS Act for enhanced punishment for repeat offences, especially after the previous convictions, which includes the imposition of even the death penalty. To constitute an offence the first time around, the minimum quantity seized should be equal to or over 250 milligrams for heroin, 5 grams for hashish or charas, 5 grams for opium, 125 milligram for cocaine, and 500 grams for ganja. Further, the Act makes a distinction between possession for personal consumption and trafficking, the punishment for the former being limited to between 6 months and 1 year only. The application of this provision is subjected to the two qualifications, that is, the quantity of the drug involved in the offence should be a small quantity as specified by the central government. The burden is on the accused to establish that the drug in question was meant for personal consumption and not for sale, distribution, etc. The central government of India constituted a Narcotics Control Bureau in the year 1986 with its headquarters at New Delhi and zonal offices at Mumbai, Kolkata, Chennai and Varanasi. In the year 1988, the central government constituted the Narcotic Drugs and Psychotropic Substances Consultative Committee, consisting of a chairman, the Minister of Finance or Minister of State in the Ministry of Finance, and 18 members from diverse fields who would, among other functions, conduct periodic review of the NDPS Act. While the NDPS Act prohibits the cultivation of poppy, cannabis and coca plant, it does not impose a total ban. Now in this table we have shown the various offences and penalties. So starting with the offence, that is the cultivation of opium, cannabis or coca plants without license, the penalty is rigorous imprisonment up to 10 years plus a fine up to rupees 1 lakh, and this has been mentioned under the sections opium 18C, for cannabis it is 20 and for coca it is 16. Next is embezzlement of opium by licensed farmer. This is the offence. For the penalty part, it is rigorous imprisonment to 10 to 20 years plus a fine rupees 1 to 2 lakhs regardless of the quantity, and under section 19 it has been mentioned. Next, if the offence is of production, manufacture, possession, sale, purchase, transport, import interstate, export interstate, or the use of drugs, the penalties will be small quantity, that is rigorous imprisonment up to 6 months or a fine up to rupees 10,000 or both. That is has been mentioned under section 18 for opium and under section 17 for the prepared opium. In case of penalties, more than a small quantity is there but less than the commercial quantity, then a rigorous imprisonment up to 10 years plus a fine of rupees 1 lakh. For commercial quantity, a rigorous imprisonment of 10 to 20 years plus a fine of 1 to 2 lakhs. Small and commercial quantities are defined for each drug separately through a notification. And under sections of 21 of this act, we have the manufactured drugs or their preparations, and under 22 we have psychotropic substances. Next, if the offence is related to import, export or transshipment of narcotic drugs and the psychotropic substances, then the penalties that I have already told you will be same, and the sections included is 23. For the offences, external dealings in NDPS, that is engaging in or controlling trade whereby the drugs are obtained from outside India and supplied to a person outside India, the penalty will be rigorous imprisonment of 10 to 20 years plus a fine of rupees 1 to 2 lakhs regardless of the quantity, and this has been mentioned under section 24 of this act. If the offence is involving knowingly allowing one's premises to be used for committing an offence, then the penalties will be same as that I have already mentioned, and it is defined under section 25 of this act. For offences relating to violations pertaining to controlled substances or the precursors, the penalty is rigorous imprisonment up to 10 years plus a fine of rupees 1 to 2 lakhs, and this has been mentioned under section 25A. With offences financing traffic and harboring offenders, the penalties will be a rigorous imprisonment of 10 to 20 years plus a fine of 1 to 2 lakh, and this has been mentioned under section 27A of this act. If the offence include there is the attempts, abetment and criminal conspiracy, then the penalties I have earlier told you will be same for this offence, and the sections that are mentioned, that is for attempt it is 28 and for abetment and criminal conspiracy it is 29. Under offence that is preparation to commit an offence, the penalties are the half the punishment for the offence, and this has been mentioned under section 30 of this act. For repeat offences, the penalties given will be 1.5 times the punishment for the offence, and death penalty is also awarded in some cases, and this has been mentioned under section 31 with death being mentioned in 31A. For offences like consumption of drugs, the penalties will be, for example, in case of cocaine, morphine, heroin, rigorous imprisonment up to 1 year, or for fine up to rupees 20,000 or both. Other drugs, it will be imprisonment up to 6 months or a fine up to rupees 10,000 or both. Addicts volunteering for treatment enjoy immunity from prosecution. And for the consumption of drugs offences, it has been mentioned under section 27 of this act, and for the immunity part, it is mentioned under section 64 of A. For offences including the punishment for violations not elsewhere specified, the penalties will be imprisonment up to 6 months or fine or both, and this has been mentioned under section 32 of the Act. Now, other Indian laws related to the usage of drugs. A number of legal acts has been passed regulating and controlling the manufacture, sale, distribution and possession of drugs. The principal acts include those that I am going to tell you here. First is the Drugs and Cosmetics Act 1940. This act was amended in the year 1964 and very recently in the year 2008 and is today referred to as the Drugs and Cosmetics Amendment Act 2008. And it deals with the import, manufacture, distribution and sale of all kinds of drugs like allopathic, Ayurvedic, Unani, Siddha, etc. besides the cosmetics also. As per the Act, every patented or proprietary medicinal preparation should display on the label of the container either the exact formula or a list of the ingredients. The amended Act has enhanced the scale of punishment for various offences including the sale of spurious drugs, adulteration of drugs and cosmetics and the toxic contamination, etc. Next is the Drugs and Cosmetics Rule 1945. This is a branch of the Drugs and Cosmetics Act 1940 and is concerned largely with the standard and quality of drugs apart from exercising control over the manufacture, sale and distribution of drugs and cosmetics. It was amended in the year 1988 and is now referred as the Drugs and Cosmetics Rules 8th Amendment 1988. All categories of drugs used in therapeutics have been compromised, including allopathic, homeopathic, Ayurvedic, Unani and Siddha. All drugs and cosmetics are compulsory to be characterized and packed properly. To advise the central and state governments on technical matters relating to drug control, several boards have been set up such as the Drugs Technical Advisory Board, the Ayurvedic and Unani Technical Advisory Boards, the Drugs Consultative Committee. In order to expedite the analysis or testing of drug samples to assess their quality, the Central Drugs Testing Laboratory, that is CDTL, was established in year 1962. Individual states have also set up the drug control laboratories. Rigorous punishments have been laid down for manufacture, stocking or sale of inferior or spurious drugs. Guidelines for conducting clinical trials for new drugs have been made more strict. That is mentioned under Schedule Y. The Drugs and Cosmetics Rule have classified drugs into various schedules. First, starting with Schedule C and C1, including the biological products, example serums and vaccines. For Schedule D, substances not intended for medicinal use, condensed or powdered milks, oats, spices and condiments, etc. Schedule E1, list of poisonous substances under the Ayurvedic including Siddha and Unani systems of medicine. Schedule G, chemotherapeutic agents for cancer, antihistaminics and hypoglycemic agents. Schedule H and L include the injectables, antibiotics, antibacterials and other prescription drugs. Schedule J includes diseases and ailments by whatever name described which a drug may not purport to prevent or cure or make claims to prevent or cure, example AIDS, cancer, cataract, congenital malformations, deafness, blindness, hydrocele, hernia, piles, leukoderma, stammering, paralysis, etc. Schedule O, standards to be followed with regard to disinfectant fluids. Schedule S, standards to be followed with regard to cosmetics and allied products. Schedule X, barbiturates and certain other sedatives, amphetamines, etc. Next is the Pharmacy Act 1948. The objective of this statute is to allow only registered pharmacists to compound, prepare, mix or dispense any medicine on the prescription of a registered medical practitioner. Under this Act, the Pharmacy Control of India, New Delhi, has been established under the Ministry of Health and Family Welfare, which regulates the study of pharmacy throughout the country. Individual states have their own state pharmacy councils for the registration of pharmacists. Next is the Drugs Control Act of 1950. The Drug Control Ordinance 1949 was promulgated in order to ensure that certain essential imported drugs and medicines were sold at reasonable prices in the Chief Commissioner's provinces. Similar ordinances were issued by all the provinces. The necessity for continuing price control of these essential drugs continues. Some provinces have already replaced their ordinances by acts and others are expected to do so. This bill is intended to replace the central ordinance. The Drugs Control Act 1950 aims at the controlling prices of essential imported drugs and medicines so that they may be sold at reasonable prices. The main thrust is to make these drugs affordable to general public. This act was intended to replace the Drug Control Ordinance of 1949. Summarily, this act regulates the supply and distribution of drugs and also guides the manufacturer or dealer in fixing the maximum price for every drug. Next is the Drugs and Magic Remedies Objectional Advertisement Act 1954. The objective of this act is to ensure that ethical standards are maintained when drugs are advertised by the manufacturer. Advertisements which offend decency or morality can be banned under this act. Also, those which claim magical powers for certain drugs, example, enhancement of potency, cure for incurable diseases, etc. Magical remedies include the use of talismans or charms such as mantras, kavachs, etc. Next is the Medicinal and Toilet Preparation Excise Duty Act and Rules 1955. This act deals with regulatory problems arising out of the use of alcohol in various medicinal and toilet preparations. It has helped greatly in curbing the large-scale interstate smuggling of alcoholic, medicinal and toilet preparations which existed previously due to different rates of excise duties in different states. This act has made uniform rates of duty applicable throughout the country. Now I will summarize all that we have studied in this module. When people continue to take drugs in the absence of disease, intensity of dependence varies from mild desire to the compulsion to use the drug and is called as drug abuse. The Narcotic Drugs and Psychotropic Substances Act, that is the NDPS Act, was enacted in India and subsequently amended in 1988 to implement the provisions of the Convention on Psychotropic Substances 1971 and the Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances 1988, both held in Vienna. The NDPS Act was amended in 1988 in order to empower the central government to declare any substance as a controlled substance and to regulate its manufacture, import and export, etc. The Government of India promulgated the NDPS, that is the Regulation of Controlled Substances Order, to regulate the manufacture, distribution, etc. of any substance declared to be a controlled substance. Failure to tender the entire yield to the government is treated as a serious offence, and any cultivator who embezzles the opium produced by him in terms of Section 19 of this Act is punishable with rigorous imprisonment for a term of between 10 to 20 years and a fine which shall not be less than rupees 1 lakh, but which may extend to rupees 2 lakh. Thank you.